Thank you. I'm really excited to be talking to everybody today. Ringworm is a pretty fun topic and also very frustrating, so I think a lot of people get out of a lot of information out of this. So I'm going to be focusing mostly on cats and kittens and the management of ringworm in a shelter setting. So why are we taking the time to learn about ringworm today? I think it's really important to remember that a lot of shelters aren't able to treat ringworm due to capacity for care concerns and limited resources. So unfortunately, euthanasia is a pretty common outcome for a lot of animals with ringworm in animal shelters, just due to limited resources. So the other important part is that ringworm is highly contagious, so it can spread throughout your shelter pretty quickly and can cause outbreaks. So it's an important disease to think about in a shelter setting. And I think it's important for LVTs and staff in general to get at least some basic understanding of ringworm, just to understand the shelter protocols that might be in place. I do think it's important throughout this lecture and just in general to remember that there's not a perfect protocol for every shelter, so taking this information and kind of trying to make it fit your shelter is going to be really important. Every shelter is going to be a little bit different based on the facility and the resources and the population. So what is ringworm? Ringworm is a superficial fungal infection of the skin, the hair, and the nails. It's also referred to as dermatophytosis, and it's a fungal infection, so it's not actually caused by a worm of any kind. And what does ringworm look like? I think this kitten is a pretty good example of like a poster child for ringworm. He's got classic lesions, which are areas of hair loss or alopecia with crusting and inflammation of the skin. You can also see broken hair and broken whiskers. The most common areas to find these lesions are on the face and the ears and the feet and the tail. These lesions may or may not be itchy. I tend to not think they seem very itchy, but they can be. Less common presentations of ringworm also include exudative lesions, so areas of hair loss with kind of a thick, sticky discharge from the surface. Large areas of hair loss with otherwise normal-looking skin, and infections of the claw and nail bed. There are also a lot of different skin diseases that can also look a lot like ringworm, including bacterial skin infections, dermatitis or skin inflammation secondary to flea infestations, allergic skin disease, mites, hair loss secondary to chronic diarrhea or food. That's really common in kittens that kind of get the food caked on their face. Also feline chin acne and mosquito bite hypersensitivity. The top picture is a cat with mosquito bite hypersensitivity causing some hair loss on the nose, and the bottom picture is a cat with allergic skin disease. So a lot of things can look a lot like ringworm. So most mammals get some form of ringworm infection. There are many, many species of ringworm, but the species of ringworm tend to gravitate towards certain species of animals. The common forms of ringworm that we see in the veterinary setting can infect cats, dogs, and humans. And the most common species that we see in the shelter and in dogs and cats are Microsporum canis, Microsporum gypsum, and Trichophyton mentagrophytes. And Microsporum canis is really the most common and the one that's the most relevant to the shelter, just because it tends to be more associated with shelter outbreaks than the other species. So there are a number of risk factors for ringworm infection, including age. Pediatric and geriatric animals are at greater risk for ringworm infection. Species and breed. Cats are at greater risk compared to dogs, and long-haired cats such as Persians are at higher risk, as well as Yorkshire Terrier dogs. Concurrent disease is also really important. Anything that causes immunosuppression, such as infection and immunosuppression secondary to FELV or FIV infection, the stress of pregnancy or lactation, malnutrition, chronic steroid use, cancer, and other chronic disease states, or recent surgery can all increase the risk of ringworm infection. And stress is really important. I think it's especially important to consider in a shelter setting, because no matter how beautiful or well managed your shelter is, the shelter is a stressful place for animals, so that can lower their immune system and make it harder for them to fight off infections. And it can also reduce normal grooming behaviors in cats, which is a natural way for them to lower the number of spores on their coat. And anything that compromises the skin integrity, such as parasites, skin infections, allergies, and over-grooming, anything that damages the surface of the skin will make that skin more prone to developing a ringworm infection. And also really important in a shelter situation is considering their previous living situation, especially if you see cats coming in from hoarding situations or otherwise dense living conditions, or community cats like cats that lived outdoors previously, or hunting and working dogs. Those are all animals that are going to be at higher risk for ringworm. So how is ringworm spread? It's most commonly spread by direct contact, so really touching another infected animal. But infected hairs and spores do get shed into the environment, but infection from the environment alone is fairly uncommon. The spores are the very small microscopic infective form of ringworm, and they're formed by the fragmentation of the fungal hyphae. And they're very light, so just like dust, they can float up into the air. And so really anywhere you can find dust in the room, you might also find ringworm spores. The incubation period, meaning the time it takes from being exposed to ringworm spores to getting a lesion, is a little bit variable, anywhere from 4 days to 4 weeks, but lesions are usually seen about 1 to 3 weeks after that exposure. So something we talk about a lot when we're discussing ringworm is whether or not an animal is a mechanical carrier for ringworm spores on their coat, also referred to as a dust mop a lot of times, versus if an animal is actually truly infected with ringworm and have an active infection. So the mechanical carriers are animals that have spores on their coat from the environment, but they don't typically have skin lesions. On the other hand, animals with a true infection, those are animals where the fungal spores have invaded the hair and the skin, and they've established growth, and they typically do have skin lesions as a result of that. So due to how easily ringworm can be spread in the shelter setting, it's very important that all animals be screened for ringworm on intake. This is just an example of how we tend to get kittens in and how we try to look at them each on intake to make sure they don't look like they have ringworm. So the best way to screen for ringworm during your intake exam is using a combination of clinical signs, which is mainly looking for the alopecia encrusted skin lesions, as well as performing a thorough Woods lamp exam. And just as an aside, staff and volunteers and techs tend to be like the frontline people to notice these things, so it's really great if you do notice any kind of crusting or hair loss. It's just nice to have everyone familiar with what ringworm looks like. So the Woods lamp is a quick and cheap screening tool for ringworm. The Woods lamp is an ultraviolet light that produces light at a specific wavelength with a peak wavelength at 365 nanometers. This wavelength of light causes the hair that's infected by some strains of Microsporum canis to fluoresce or to glow. This will only detect infection by Microsporum canis and not the other species of ringworm that we're talking about today. And based on an old statistic, and I still hear people quote this a lot even today, it was previously thought that only 50% of Microsporum canis infections would fluoresce, but a little bit more recent evidence and, based on experts who really study ringworm all the time, they consider this to be a fairly reliable screening tool for Microsporum canis infections, with the assumption that the majority of these cases will fluoresce. So it's a little bit more of a reliable tool than I think people thought of it in the past. So in order for your Woods lamp exam to be as accurate as possible and have as few false positives and false negatives, it's really important to follow a few steps and really just try to take your time. I feel like rushing through it is when we make the most mistakes. So you want to make the room that you're in as dark as possible. So you want to close all the blinds, turn off the lights. Sometimes I even turn off the computer monitors if they're causing too much light in the room. And give your eyes a little bit of time to adjust to the darkness. And then you want to plug in and turn on your Woods lamp and give it a little bit of time to warm up. I usually just plug it in and turn it on right before my physical exam, and that gives it a couple minutes just to warm up to reach like the full power. And then you want to hold the Woods lamp as close to the animal as possible so that you can see all the individual hairs. And it's helpful if your Woods lamp has a magnifying area, but if not, you just want to get really close to the animal so that you can see each individual hair up close. So you want to carefully scan the entire body and definitely make sure to focus on those really common areas like the face and the ears and the paws. And then you want to also closely examine any areas that have hair loss or crusted or irritated skin to look for these infected hairs. And so a positive result for ringworm under the Woods lamp will be a bright, typically it's called apple green or just like this neon green color of the hair shaft. And it should be the entire hair, like in these photos. You can see each hair separately and individually glowing that bright green, especially at the hair base. So it's important to remember that the hair shaft itself should be the part that's glowing, not the skin or the crust on top of the skin. Glowing hair is the result of a metabolite or a byproduct of the fungus that coats the hair shaft, and it's not actually due to spores on top of the hair. So it's also important to remember that this is only checking for Microsporum canis infections. So if you have an infection with Microsporum gypsum or Trichophyton mentagrophytes, that won't glow positive on the woods lamp. So if you do have a suspicious lesion that doesn't test woods lamp positive, you still want to pursue additional diagnostics if you are concerned that it could be ringworm. Something to keep in mind also is that there are a number of materials and medications that can also glow. Doxycycline and a lot of eye meds will also show up bright green under the woods lamp. And I usually just try to take like a warm, wet piece of gauze and wipe it away, and then try rechecking the woods lamp. Usually the fluorescence will at least get weaker after you wipe it away. It might look smeared, but it's pretty common to have some contaminants on the coat. Another way of diagnosing ringworm is with a test called a trichogram. The trichogram is a direct microscopic examination of the hair to assess for changes associated with ringworm infection. And you can use this test to confirm a positive woods lamp exam, but I tend to find it most useful when you have a little bit of a questionable woods lamp exam. You're not 100% sure based on what you're seeing. So you can pluck some of those hairs and look at them under the microscope and look for the characteristic signs of ringworm infection in that hair. It is important to remember that you can't use this test to rule out a ringworm infection. If you do see one of these hairs, which there's a better picture on the next slide too, that's a little bit bigger, that can really help support a diagnosis of ringworm. But if you don't see these hairs, you can't say for sure that it's not ringworm. So you'd have to pursue further testing at that point. So how do you perform a trichogram? First, you want to pluck some of the hairs from the suspicious area. And it's best if they're the woods lamp positive hairs, since those are the hairs that are most likely to be infected. And then you want to suspend those hairs in mineral oil on a microscope slide, and then examine the slide under the microscope at 4x or 10x magnification. And the infected hairs will be more pale and swollen and frayed and irregular, and they've basically just lost their normal structure. And you can see from the picture, the one on the left is the ringworm infected hair. So this is a short video about ringworm screening in the shelter.
Ringworm screening can be performed by trained laypersons operating under a veterinarian design protocol and should include 2 people, one for animal handling and another for examination. At a minimum, when ringworm is suspected, the screening process should include a visual examination followed by examination with a woods lamp. Positive results should be followed up with a fungal culture. Where available, microscopic examination of fluorescing hair should also be considered. New single-use examination gloves should be worn when evaluating animals suspected of having ringworm. Step 1. Perform a visual examination. Thoroughly examine the skin under a bright light for any areas of hair loss, redness, pigmentation, broken hairs, excessive shedding, flakes, or crusts. Pay close attention to the muzzle, lips, around the eyes, ears, abdomen, toes, and tail. Step 2. Examine the fur with a woods lamp. A woods lamp is a special ultraviolet light with a 365 nanometer wavelength. It is not the same thing as a black light. Woods lamps that plug in are generally more effective than those that are battery operated. When ready, turn the woods lamp on and the examination room lights off. Allow 2 to 3 minutes for the observer's eyes to adjust to the light, then repeat the visual examination under the woods lamp. Look for hairs to glow blue-white or bright apple green at the base of the hair and along the shaft. Note that contaminants on the fur, such as doxycycline, terramycin, and dander, can also fluoresce under a woods lamp. Contaminants can be distinguished from ringworm-infected hairs because they are generally smeared or crusted on the fur, may cause individual hairs to stick together, and the hairs will not fluoresce once the contaminant is brushed away. Step 3. Once infected hairs have been identified, collect samples for microscopic examination and fungal culture. When sampling is complete, the examination area and the woods lamp should be cleaned, disinfected, and prepared for the next patient.
So what do you do if you have a suspicious lesion and your initial diagnostics are inconclusive? So you can't tell from the woods lamp or the trichogram for sure if you have ringworm or not. That's when you'll want to either do a fungal culture or fungal PCR to further investigate for ringworm infection. And if you are waiting on those diagnostics, You want to keep these ringworm suspect animals separate from your general population until you have those results. So the IDEXX real-time PCR test is a test where you send samples of hairs from the animal that is in question to a laboratory where they're testing for fungal DNA in the sample. In theory, this is a very sensitive test for a ringworm, but like any test, you can have false negatives, especially if you have some poor sample collection. It's also important to note that this test only tells you whether or not there's evidence of spores on the coat, so it pretty much just gives you a yes or no answer, positive or negative. So it can't help you determine if the animal's a desmop or a mechanical carrier for spores versus if they're truly infected. So there's some limitations of the test, but it is helpful to use it as kind of a piece of your diagnostic puzzle, just to give you a quick yes or no. I tend to like this test if I'm trying to kind of give more evidence to support my assumption that it's probably not ringworm, just so I have a little bit more confidence moving the animal through the system. It is more expensive than a DTM, but it gives you results in about 3 business days, so there's some pros and cons. The next diagnostic test is the fungal culture. The fungal culture using the DTM plates is the most reliable way to diagnose ringworm. This test allows you to confirm infection, track treatment progress, as well as confirm cure after treatment. And this uses dermatophyte test medium, or DTM, to grow the fungus on a plate. And this special media has an indicator built in it that changes the media red when there's pH change, and that's usually associated with fungal growth. So the color change can help aid in the identification of ringworm colonies on the plate. So to review how to collect samples and plate a DTM, this is another thing that you may have already done in your diagnostic lab. But you want to make sure your DTM plates are at room temperature before you plate them. And then you want to take an individually wrapped toothbrush and collect samples from the entire animal. Some people like to say 20 to 30 brush strokes. Other people say 2 to 3 minutes of brushing. The important thing is that you brush all the areas of the cat first, and you want to really make sure you focus on those really common areas like the face and the ears and the paws, and then go back after to brush the suspicious lesions last. The idea there just being that you don't want to spread spores if those lesions are in fact ringworm to the rest of the body. And then once you have a really good sample with lots of hair on your toothbrush, you want to gently brush the toothbrush tips onto the DTM plate and cover the plate in a consistent pattern. Most people do a little spiral pattern around the plate. And if you want to, you can also pluck hairs from the suspicious area, and it's the best if they're Woods lamp positive hairs, since those are the most likely to be infected. And then you can press those onto the DTM plate also. And you want to store the DTM plate upside down in the incubator and set the incubator for 80 degrees Fahrenheit. And this is a short video on obtaining samples.
When ringworm is suspected, animals with positive screening tests, active dermatologic lesions, or a clinical history suggestive of ringworm should be followed up with a fungal culture. Where available, microscopic examination of fluorescing hair should also be considered. Additional means of diagnosis include culture or PCR performed at a diagnostic laboratory. New single-use examination gloves should be worn when handling animals suspected of having ringworm. Method 1. Microscopic examination. Prepare a clean microscope slide with a drop of mineral oil. Identify hairs that fluoresce under Woods lamp examination, and using a clean pair of forceps, gently pluck the hairs in the direction of growth. Place the plucked hairs into the mineral oil and examine the slide under a microscope using 4x magnification. Infected hairs appear wide and irregular. Occasionally, fungal spores and hyphae can be seen. Method 2. Perform fungal cultures. Before treatment has begun, use a new toothbrush and vigorously brush the animal's entire body for a minimum of 3 minutes. Brush any areas with skin lesions last so as to minimize contamination of the rest of the coat. When complete, gently push the toothbrush bristles into a fungal culture plate. Starting in the center and working outward, cover the entire surface of the plate. Discard examination gloves and label the plate with the animal's ID number and the date of collection. Method 3. Diagnostic Laboratory. To obtain samples for fungal culture, gently pluck hairs that fluoresce under Wood's lamp examination or those from the edge of suspicious lesions. Collect a minimum of 10 to 20 hairs and place them into a paper envelope, labeled with the animal's ID number and date of collection. Place the prepared sample in the refrigerator until submission to the diagnostic laboratory. When obtaining samples for PCR testing, gently pluck hairs that fluoresce under Wood's lamp examination or those from the edge of suspicious lesions. Collect a minimum of 10 to 20 hairs and place them into a sterile sample tube, labeled with the animal's ID number and date of collection. Place the prepared sample in the refrigerator until submission to the diagnostic laboratory. When sampling is complete, the examination area should be cleaned, disinfected, and prepared for the next patient.
So some of the ways you send your samples out to the lab will also just depend on the lab you work with. So some of that is just variable. So once you have your DTM plate inoculated with your sample, you want to check that DTM plate daily to monitor for any colony growth. Red color change of the DTM plate with white or slightly off-white fluffy colony growth at the same time is consistent with ringworm. Colony growth often occurs within a week, but it can take up to 21 days, and a lot of that depends on what species is growing. Trichophyton species tend to take longer to grow on the plate, and animals that have been under treatment also tend to have delayed colony growth. It's also important to note that not all red color change of the DTM plate means ringworm. It's simply an indicator of pH change, so it should heighten your suspicion of a colony, but it's not confirmation of a positive plate. Typical ringworm colonies will have a red color change develop around them as they grow, but no suggestive colony growth at day 14 can be considered a negative plate. DTM plates will also often grow contaminant fungal organisms, so pigmented colonies, anything that's like black or green or gray, brown, something pigmented, that's most likely to be a contaminant colony since ringworm is pretty consistently white or slightly off-white. So just a little bit about the pathogen scoring system, also referred to as P-scores. One of the advantages of using a DTM for ringworm diagnosis is that you can actually use the number of colonies on the plate. So the colonies are the white fluffy dots on your plate. And if you count the number of macroscopic colonies on the plate, it can give you information about the severity of the infection and can also be used to monitor response to treatment and help you make some treatment and pathway decisions. So the P-scores range from 1 to 3. P1 is 1 to 4 colonies on the plate, P2 is 5 to 9 colonies on the plate, and P3 is 10 or more colonies. And these are just a little bit more up-close pictures of the different P-scores. So P1 being the fewest number of colonies and P3 being 10 or more, so lots of colonies. So how can we use the P-scores to help us make some decisions? First of all, the P-scores can help us track treatment progress. So the number of colonies on the plate should in theory get smaller and smaller while the animal is under treatment and should eventually reach no growth by the end of treatment. And we can also use the P-scores to help us determine if the animal is a dust mop, meaning that they're the mechanical carriers of spore on their fur, but not actually infected with ringworm, versus if the animal is actually truly infected. So for example, if an animal has a suspicious skin lesion consistent with ringworm and any level of dermatophyte growth on the DTM plate, I'd consider that to be like an actively infected animal based on the clinical signs and the fungal growth on the plate, and I'd go ahead and recommend isolation and treatment for that animal. On the other hand, if an animal has no visible skin lesions and the Wood's lamp exam is negative and they have a low P-score on their DTM plate, meaning like P1 or maybe like a low P2, such as like the photos on the top corner, then that animal is pretty likely to be a dust mop since they're not showing any clinical signs and they have really few colonies on their plate. So that might be a good recommendation or a good candidate for a lime sulfur dip and to move them along through your system since they're not showing any active signs of infection. I would, before you move them along though, just double check your physical exam, double check that you're not missing any lesions and a Woods lamp, just because skin lesions can also pop up while you've been waiting for the plate to grow. So double check your physical exam and your Woods lamp, and then consider moving them along if they look good. MP3, the colony or the plates that have a large number of colonies, is pretty consistent with a true infection, so those animals do typically have skin lesions. So once you have a fair amount of colony growth on the DTM plate, you can perform the microscopic examination of the colonies to confirm the ringworm diagnosis. And you can also do this to help determine if the colony growth is due to a contaminant. And you can also determine the species of ringworm that's causing the infection by doing the microscopic analysis. So the microscopic examination can be done in-house, which I know also you worked on today. Or you can submit the entire DTM plate to the laboratory for them to do it. In early stages of colony growth, it's not uncommon to just see fungal hyphae and no macroconidia at first. So those plates, you just want to keep incubating them and check them daily or every other day, whatever you can do to keep rechecking for the development of the macroconidia, which is how you're going to identify what species it is. So to quickly go over how you do the microscopic examination of the fungal colonies, wearing gloves, you want to put 1 drop of the lactophenol cotton blue stain on a microscope slide, and then take a piece of clear sticky tape and press it down onto the fungal colony to get a little bit of the colony on the tape, and then press the sticky tape down over the blue stain on the slide. And additional drop of, it's not necessary, but it's optional. You can take an additional drop of the lactophenol cotton blue stain and put that on top of the tape and add a cover slip. That can just help you see it better. And then you want to examine that slide under the microscope, under high magnification, so going up to the oil lens, and look for characteristic macroconidia of the different species. The top photo shows you kind of how you would prepare the tape prep. So putting the tape that has the fungal colony on the sticky side over the stain that's on top of the slide. And then on the bottom is an example of the macroconidia for Microsporum canis. So the Microsporum canis macroconidia they're large and they're spindle shaped. And they have thick walls and 6 or more internal cells. So those divisions within the macroconidia, there should be 6 or more. They typically have a terminal knob at the end, so that spindle shape kind of tapers to the end. And the macroconidia for Microsporum gypsum are also large and spindle shaped, but they have thinner walls and 6 or fewer internal cells, and they don't have that terminal knob taper at the end. They kind of have a more blunt end. And the macroconidia of Trichophyton mentagrophytes is a little strange, but they're long and cigar shaped, and they have thin walls. And the Trichophyton also has these characteristic spiral-shaped fungal hyphae, and they often have the clusters of little microconidia also. So before we jump into discussing treatment of ringworm, I wanted to take just a minute to stress the importance of considering the animal's overall welfare when we're making the decision as to whether or not we're going to treat that animal for ringworm. Ringworm requires prolonged confinement, typically weeks to months in isolation. And it also requires frequent handling for oral medications and topical treatments. So because of this, treatment's not always safe or humane for all the animals that might be diagnosed with ringworm. And an example of this might be a really under-socialized cat that's super fearful of humans. Treating that cat in isolation and putting them through all the oral and topical medications might cause significant fear, anxiety, and stress, and might not actually be in his best interest. And it's also important to keep in mind that a number of the animals in our ringworm isolation areas are going to be kittens. And that's usually during a critical time in their lives for socialization. So meeting their behavioral needs can't be ignored while they're in isolation for treatment. So while ringworm is a very treatable disease medically, it is really important that we make thoughtful decisions to select appropriate candidates for treatment. And if we are going to treat them, we have to make sure that we're able to meet their behavioral needs while they're in isolation. So when should you start treatment? If an animal's showing classic skin lesions and they have a positive Woods lamp exam or a trichogram, that's generally enough information for me to recommend isolation and treatment, although I'd still collect a DTM plate to confirm the infection. And if you have a questionable exam or Woods lamp findings and you're waiting on your DTM or PCR results, then I recommend keeping the ringworm suspect animals separate from your general population as much as you can while you're waiting for those results. And if you do have a really highly suspicious lesion, you can also consider starting treatment while you are waiting on those confirmatory results. So treatment of ringworm consists of isolation, topical therapy, and systemic therapy. Isolation is a really important aspect of treatment, and it's essential to preventing spread of ringworm throughout the shelter. Isolation space will very much depend on the facility. I've seen some shelters that have like a shed or a trailer that's separate from their main facility. At the adoption center, we just have a separate room that has a vestibule that allows you for changing your PPE. So it just depends on the way your shelter is designed, but you want to keep them as separate from your general population as you can. And ringworm-infected animals should be handled last, and appropriate personal protective equipment should be worn when you're working with those animals. And if you're treating animals, ringworm animals in a foster home, you just want to keep them in an area that's easy to disinfect and as far away from other animals as you can. So, topical therapy is really important for minimizing environmental contamination. Lime sulfur dip is the most effective topical treatment that we have, but there are other treatments that are out there, including Malicept shampoo, which is a miconazole chlorhexidine-based shampoo, pure oxygen shampoo, which is an accelerated hydrogen peroxide-based shampoo, and alkanazole, and other topical treatments such as like a miconazole cream. But it is really important to remember that the lime sulfur dip is definitely the most effective, so if you want to minimize your treatment time, it's best to stick with the lime sulfur dip. So lime sulfur acts to reduce environmental contamination by inactivating the ringworm spores on the surface of the fur. So it smells really bad and it can stain things, so people generally hate doing these dips, but it is recommended to do them twice a week to have them be most effective. You don't typically need to clip the fur, only if they have really long fur or if they're really matted do you need to clip them, but otherwise you can just let them be. But you want to make sure that the dip is able to contact the skin and get to the base of the hair, so if there's a lot of fur or matting, that's why you might want to clip them. Due to the stress of dipping in general, we started doing pre-medication with gabapentin just to help alleviate some of that stress, so that's something that you can consider just to help take the edge off. And lime sulfur dip is also safe for lactating queens and kittens, so you can use it in these populations. You just want to make sure that you're providing appropriate heat support for when they're drip drying. So to quickly go over kind of the recommended way of performing a lime sulfur dip, it's really best if you can use a sink or a large container like they have in this photo, and a small garden sprayer. It just causes less stress than dipping cats, like submerging them into a dip bucket. And it's less stressful and it has less cross-contamination issues than if you put them in a actual dip. So to make the lime sulfur dip, you want to mix 8 ounces of your lime sulfur solution with a gallon of warm water. And you want to make a fresh batch of your dip each time. And you want to make sure you're soaking the entire cat to the skin surface. So it's really important that the solution reaches the base of the hair. So you don't want to just wipe it, on top of their fur. You want to make sure it's getting really down to the skin. And you want to be really careful around the face and the eyes. You can use a cotton ball or a small piece of sponge just to gently dab the dip in that area. And I found it's kind of one of those debatable things about whether you pre-lubricate the eyes or not. I find that if you get lime sulfur dip in their eyes when they have lube in it, it's really hard to get it out sometimes, so it kind of traps it. So I tend to recommend just having sterile saline eye wash with you when you have the dips, so that if you do get in their eyes, you can just quickly flush their eyes out. But that's kind of just my recommendation. And other than that, you don't need to use an e-collar. It's okay if they groom a little bit off. It might make their tongue look a little discolored, but it's not toxic. And you want to make sure you're providing heat support, especially for the kittens when they're drip drying. You can use heat lamps or heat discs for this. And oh yeah, you also don't want to pre-wet the cat, so you don't want to wet them down first, and you don't want to dry them off after the dip. You just want to make sure you're putting the dip on their dry fur and allowing them to drip or air dry. So lastly, systemic therapy is a really important aspect of treatment also to help the animals clear their ringworm infections as quickly as possible. There are a number of different protocols out there, and there's not a consensus on what the best treatment protocol is, but there are 2 oral antifungal medications that have been proven to be effective, and those are itraconazole and terbinafine. So it's not recommended to have compounded itraconazole, as that has been shown to be less effective than the brand name form. And you want to make sure, especially in kittens, that you're rechecking their weights frequently, at least once a week, to make sure you're dosing them appropriately, because they can grow out of those dosing intervals. So there are also a number of products out there that have either been used as treatments in the past or have been proposed as potential treatments, including griseofulvin, fluconazole, ketoconazole, lufenuron, or there are also like ringworm vaccines that have been proposed, but they're either not as effective or they have more side effects or both in some cases. So it's just recommended to stick with either itraconazole or terbinafine in terms of your systemic therapy. So once you've started treatment with your topical and systemic therapies, you'll want to be monitoring the animals for response to treatment and hopefully confirming cure at the end of treatment. So the total time for ringworm treatment, including confirmation of cure, is usually around 6 to 8 weeks, but it can take as long as 3 to 4 months. So you want to repeat the DTM cultures every 7 days and continue treatment until you have 2 negative DTM plates taken a week apart. And the DTM plates should be negative on day 14, or at least that's our recommendation. And you also can use a Woods lamp to monitor the response to treatment. When an animal's on treatment, the fluorescence of the hairs typically gets lighter and lighter, and the glowing part will move towards the tip. It is important also to remember that sometimes, especially with kittens, they can look a little scruffy at the end of treatment, and their hair regrowth can take a little bit of time. So this comes up a lot. It's often the case that we do get a litter of kittens in, and maybe only 1 or 2 of them have like classic ringworm lesions and a positive Woods lamp, and the rest of them either don't have lesions yet or the lesions are so small that we just can't see them, and they don't have a positive Woods lamp. And the question becomes, do you treat them all or do you just treat the symptomatic ones? And we typically treat them all at the same time, and that's because kittens just being young and their immune system being not mature yet, they're at really high risk of developing ringworm. And like we said before, direct contact is the most common way for spread, and littermates have had a lot of direct contact, so the chances of them developing ringworm are pretty high. And it's also good for their socialization and behavioral needs to keep the kittens together so they can kind of keep each other company and support their behavioral health. It is important, though, that each kitten get their own diagnostics. So when you're repeating the DTMs, you want to do each kitten individually so you can monitor each one's response to treatment and also confirm their cure. And along those lines, singleton kittens, we recommend pairing them or grouping them with other kittens to help support their behavioral health. It's if you ever have had or known a singleton kitten, they can develop some problematic behaviors later on in life. So if they're going to be in isolation and not getting a lot of socialization, it's really important that we try to, support their behavioral needs while they're in isolation. And it is ideal if they're at a similar stage of treatment, but sometimes you have to balance their behavioral needs with their medical needs. So another question that tends to come up a lot is, why do we even treat ringworm? Ringworm is a non-life-threatening skin disease that can resolve on its own without treatment. So, why do we make such a big deal about it? So, first of all, ringworm is zoonotic, meaning that people can get it from animals. So no matter what your role is in the shelter, we're all part of a public health profession. So we have a duty to protect the staff and the volunteers and the adopters that may be interacting with these animals. And secondly, self-care can take months. So it typically takes about 3 months for an animal to clear a ringworm infection on their own. And that's kind of a best case scenario, really. If you're in a shelter and you're stressed out or you have concurrent disease, that could take even longer. So in order to reduce the animal's length of stay in the shelter and get them in a home more quickly, treating them is worthwhile. And also, if you actually, sit down and do the math and determine the cost it takes to care for an animal, like house and feed and clean them, and a shelter each day, you're actually likely to save money by reducing the number of days in care for that animal. And lastly, treating ringworm actually reduces the contamination of the environment and reduces spread of the disease. So it's important to treat it for a number of reasons. So the most effective ways of preventing ringworm spread in the shelter is to make sure you're screening for ringworm on intake, screening animals before introducing them into group housing, and appropriate use of personal protective equipment, so gowns and gloves or whatever you're able to use, quarantining of exposed or suspect animals, so keeping them separate from the general population, and isolating the infected animals, and following the appropriate disinfection protocols. So this tends to come up a lot with if you have kittens in foster and they come back and they have ringworm. A lot of times you get stuck with the situation of how do you decontaminate an animal an environment that's contaminated with ringworm. So ringworm spores are very, very durable. They can remain infective for months or even years. So you don't want to just wait out that time. It's better to try to decontaminate the environment. And it's a 3-step process. So you really want to start with the mechanical removal of debris, which is, in the ringworm sense, is essentially hair removal. And the second is you want to clean with a detergent or like a soap type based product. And then finally, after everything's clean, you want to disinfect with a product that's effective against ringworm, which is bleach or an accelerated hydrogen peroxide based product like Rescue. So the best way to mechanically remove debris and hair is with an electrostatic sweeper, such as a SULFUR sweeper. You want to avoid sweeping as much as possible because that can kick up dust and spores back up into the air and spread them around. You can also use a vacuum or a steam cleaner to try to clean carpets and rugs and sofas, stuff with like a fabric type material, making sure to change the bag after you clean to try to prevent the recontamination of the environment by spreading the spores back into the environment. So then after you've removed as much hair as possible, you want to clean with a detergent product and then thoroughly rinse and dry any kind of surface that you can. And then you disinfect with Rescue at a 1:16 dilution or bleach at a 1:32 dilution. And you want to make sure you allow for a full 10 minutes of contact time, so leave that solution in place for 10 minutes before you wipe it up. And if you want to make sure that you are confirming that the area has been thoroughly cleaned and disinfected, you can actually collect samples using a SULFUR sweeper and just collect samples from all over the environment, anywhere you might find dust or places where the cat maybe hung out, and then plate that onto a DTM plate and see what grows. As for laundry, you can wash laundry embedding in a regular washing machine using hot water. It's really important that you don't overload the machine because it's getting a thorough wash and getting that agitation is really important. So don't overload the machine. But you can use regular laundry detergent. You don't actually need to use bleach. It hasn't been shown to be any more effective than using a regular washing system. But you do want to make sure that you thoroughly dry the laundry at a high temperature. So you don't want the laundry to be damp at all. You want to make sure it's completely dry. And at the end, you want to clean the lint trap to remove any possible spores that could cause recontamination. So when possible, it's really ideal to have separate designated staff and volunteers for ringworm isolation areas to prevent the spread of ringworm throughout the shelter. If that's not possible, you just want to make sure that ringworm animals are handled last and appropriate PPE is being worn. So another thing that tends to come up a lot is people ask me all the time about their own risk of contracting ringworm after they've interacted with a ringworm positive animal. And so humans are more commonly get ringworm from a different species of ringworm, which is what these photos are showing. So this is like a human species of ringworm that's causing that infection, but we can get lesions from the species that we're talking about today, the most common ones in dogs and cats. The incubation period is similar, so anywhere from a few days to a few weeks after exposure. And really the best thing that you can do to prevent yourself from getting ringworm is wearing appropriate PPE, so like gowns and gloves when you're handling these animals, and washing your hands often. Even if you don't think an animal has ringworm and they're not a ringworm suspect, that's pretty true for really any infectious disease, is hand washing is key to preventing spread. So washing your hands and using appropriate PPE is the best thing. And then if you think you have a suspicious lesion, I usually tell people to keep it covered with like a Band-Aid or clothing until you can see a doctor for some appropriate treatment. The good thing is, honestly, that the most common complication for Microsporum canis infections in the immunocompromised people is a prolonged treatment time. So it's not life-threatening, but it is a really, it's not good if you're immunocompromised. It'll make it harder to fight off this infection. So volunteers provide really very much needed socialization time for animals undergoing ringworm treatment. Providing for the behavioral needs of the animals undergoing treatment should not be considered optional. So because of this, volunteers play a really huge role in making the treatment of ringworm possible in shelters. And also, to briefly touch on the option of treating ringworm in foster homes, many shelters are moving towards foster-based care of kittens, and ringworm is a really common disease in this population. So fosters that are willing to take in ringworm-positive kittens and care for them in their home do very important life-saving work for these shelters. And but it is really important to make sure you're picking your fosters carefully, making sure that they fully understand the risks involved, including the potential for people or pets in their home to contract ringworm. And it's really best if they're able to house the ringworm-positive animals in an area that's easy to disinfect and away from any of their other animals, and wear designated clothing or PPE when they're handling those animals. There are some advantages, though, of treating ringworm in foster. You can be a little bit more flexible with your treatment plans. So for instance, if you have a foster that really doesn't want to do lime sulfur dips, you could consider swapping out your lime sulfur topical solution for like one of the shampoos that just smells better. So you might get better compliance that way. The downside is you have to kind of expect a longer time to cure since you're not using the most effective treatment. But if the animal's in a comfortable foster home, that length of stay isn't quite as much of a concern. You can also consider spacing out your DTM rechecks to match up with the FERCP vaccine, something like that, where you can have the fosters come in less frequently. So there are just some advantages that you can just be a little bit more flexible with. And very briefly also, ringworm in dogs is generally considered less contagious compared to ringworm in cats, and ringworm in dogs is also typically cleared more quickly than cats. So each shelter will have to determine how to best house and care for the animals that have ringworm, just to help support their behavioral health while they're undergoing treatment. But like cats, ringworm in dogs is more common in the young and the immunocompromised. And those puppies actually, they were ringworm puppies that were in St. Croix, if anyone happened to be there. They're really cute. So as a last reminder and final takeaway point, while ringworm is a very treatable disease medically, it's really important that we consider the animal's overall welfare. So the animal's mental health should be part of the decision as to whether or not we pursue treatment. And if we do decide to pursue treatment, the animal's behavioral health must be a priority while they're in isolation for treatment. As for references and just resources in general, the top paper, the dermatology paper, is a consensus guidelines for ringworm that came out in 2017, and it has a ton of information. So that's also free, so you can access that. ASPCA Pro has also a number of webinars about ringworm and other things. And the shelter medicine website for the University of Wisconsin has a very detailed, very helpful ringworm website. So, okay. Well, thanks everybody.
Thank you.